Radiofrequency ablation is the other technology available to doctors for treatment of the refluxing saphenous vein. Again, the saphenous vein is a vein that runs on the inner aspect of the thigh down into the calf. This vein has a tendency to fail, meaning that the vein will dilate, the valves will separate, and the vein no longer functions properly. A normal saphenous vein will transport about 8 to 10% of the blood back to the heart. The remainder is done by the deep or primary veins. But when the saphenous vein becomes incompetent or leaky or refluxing, these are all terms that we will use, meaning the same thing, that blood is now going down the leg towards the foot instead of up the leg towards the heart. When this vein refluxes, the blood pools in all the veins attached to it, which are usually down in the calf, and then you get bulging varicose veins in the calf. So just like laser ablation of the great saphenous vein, radiofrequency ablation is a catheter that's inserted inside of the great saphenous vein. Usually we will enter the vein down by the knee with a needle and insert this catheter up the vein towards the groin. After the catheter is positioned, we surround the vein with local anesthesia, therefore numbing up the vein and making it a painless procedure. When the radiofrequency generator is activated, it delivers radiofrequency energy to the vein, which basically causes heating of the vein. And as we withdraw the catheter from groin to knee, that vein slowly seals closed. It's the same end result as endovenous laser ablation in that when we look at the vein with ultrasound at 1 month, 6 months, or a year afterwards, what we will see time by time is shrinking of the vein and eventual disappearance of the vein. That's the ultimate result. We can take the great saphenous vein out of the circulation because it's not a main vein. The main veins are deep in the muscles. These are the femoral and popliteal veins. And as long as these are normal, we can remove a sick vein out of the circulation. Radiofrequency ablation has also replaced the traditional procedure, what they call vein stripping, whereby the patient goes to the operating room under general anesthesia with large incisions at the groin, knee, and ankle. The vein is traumatically removed and the recovery is longer and the results aren't as good. So radiofrequency ablation is a minimally invasive procedure that entered the marketplace in 1999. There's a lot of data available. There's been about 500,000 cases done worldwide with excellent results. Radiofrequency ablation is also covered by insurance companies. The doctor needs to make a case that the vein is causing problems such as symptoms and inhibiting activities of daily living, meaning that the patient will develop a complication if this vein is not treated. If all the information is submitted to the insurance company with a good report of the symptoms and findings with ultrasound, insurance companies will reimburse.